why do we need this as compared to what AHS was doing before? And why would it be any different from this agency doing from AHS?
So giving an agency its own autonomy, governance, budget, structures, and policies really gives the voice to primary care that we've all been talking about in the system for a long time. It's extremely difficult to run a multi-billion-dollar organization and have everyone's voice heard. And so this really gives primary care the opportunity to be at the table as an equal player with acute care and other sectors of the health system.
So maybe define what is going to go into primary care and the things that the structure and the way it will work. Because it seems like a lot of people are saying, well, now we're going to have a whole bunch of other bureaucracies that we didn't have before. So I don't understand why that is better.
So the reason it's better is that then we can really focus on primary care. So you asked about the pieces that would be involved. So when we think of primary care, most of us think of a family doctor,
right?
But it's not just a family doctor. Really, team-based care is having all the different healthcare providers that need to be there to make sure we do healthcare prevention, screening, but also chronic disease management and keeping people out of the hospital. And so with an aging population and a booming population of babies as well, we need to make sure everyone can get their care in their community. And that's what the organization is really going to focus on.
One of the things that people worry about is not having a family doctor. And there's a lot of us that don't have family doctors. And it seems like in this new way of looking at things, it's like, well, you might not have a family doctor, and that's okay. And a lot of people don't feel like that is okay. What would you say to them?
So I would say that there are reasons to have physicians, absolutely, and there's reasons to have a broader care team. And so for a lot of chronic diseases that you're managing or for episodic care, you might need to see a pharmacist, you might need to see a nurse practitioner, but obviously there are certain things that only a family doctor can do. And that's why it's really important that we continue to recruit, retain, and have a happy, healthy workforce.
Would your group, your organization, change the way physicians run their businesses?
Absolutely. We're looking at how clinics need to be run and how we can allow, as you said, doctors to be doctors if they don't want to be business people as well. So all of this is on the table as we go forward, and having an organization dedicated to primary care will allow us some of the legal authority and structure to do that.